Now, nitric oxide is pretty unstable and it readily reacts with other molecules in its vicinity, but that nitric oxide that is generated is capable of diffusing out of the endothelial cells and towards nearby smooth muscle cells. So the proximity is important here. Now, when we take a look at the impact that nitric oxide has, it's going to head towards smooth muscle cells and it's going to help to stimulate cyclic GMP synthesis. Now, we've talked about cyclic AMP, which is discussed within the cell communication chapter. Cyclic GMP is comparable, except it's just a different modified nucleotide. And so instead of adenylyl cyclase, there's guanylyl cyclase. And so we take GTP and convert it to a cyclic GMP, so a monophosphate. And then we have our pyrophosphate that results from that. Now, when we have our cyclic GMP present, that's going to trigger a response that causes the muscle cells to relax. Now, when we have muscle relaxation, that is going to increase blood flow. Now, as an example, nitroglycerin is a drug that can be used to treat chest pain caused by insufficient blood flow to the heart. And the term for that would be angina. And that helps to release nitric oxide and increase blood flow. But it's only thought to be moderately useful. Now, there's also the drug sildenafil, which can help to inhibit phosphodiesterase activity. Now, recall that phosphodiesterases are enzymes that help to convert our cyclic nucleotide back to the non-cyclic version. And so in this scenario, we have a phosphodiesterase inhibitor that is going to prevent cyclic GMP from being converted into GMP. That's going to increase concentrations of cyclic GMP and therefore help to promote continued muscle relaxation. And that drug, while initially designed to treat cardiovascular disorders, was actually shown to have another effect and is now trademarked under the brand name of Viagra. So here we think about the relationship of blood pressure and gravity, and the process of fainting is a result of there not being enough blood flow to the top of the body, specifically the head. And an animal that would have a really long neck, we would expect to have some type of adaptation in order to ensure that enough blood is getting to those upper extremities. And so an animal like a giraffe is going to have a really high systolic pressure in order to be able to pump blood across that distance against the force of gravity towards the head. Now, when it comes to pressure in general, from our earlier discussions, we know that blood pressure really tapers off as we get to the veins. And when it comes to the veins, it becomes really difficult or inadequate on its own for the blood there to return to the heart for subsequent circulation. So as a result, there are different mechanisms that help to assist with venous return. Here is just one example, but there are several. So the one that's shown here is a muscular pump, and this is going to be based on the movement of skeletal muscle. So the skeletal muscle here we see is surrounding the veins. And as the skeletal muscle surrounding the veins contract and relax, they're going to squeeze blood towards the heart. And as blood goes past a particular valve, that valve is going to close off, and that's going to prevent any backwards flow. So we can ensure that we continue to make our way towards the top of the body. So something to consider is that people that have professions in which they stand still pretty consistently for long periods of time are going to have issues with blood pooling in their lower extremities because they're not going to have enough skeletal muscle contraction going on in order to ensure that that blood returns effectively. Measuring blood pressure is one way of monitoring circulatory efficiency within an individual. And most often, it's a measurement of systemic arterial blood pressure, and it's done through measuring the brachial artery. Now, in this scenario, we're using a sphygmomanometer, and that is essentially a blood pressure cuff. Now, in this scenario, we're going to wrap the blood pressure cuff around the arm superior to the elbow, so meaning above the elbow, and inflate that cuff with air and apply enough pressure through that blood pressure cuff such that it exceeds 120 millimeters of mercury. When that cuff is inflated with air that exceeds the systolic pressure, blood flow into the arm is going to stop, and the brachial pulse is not going to be able to be felt or heard. So we have the artery closed off, nothing's going to be felt, nothing is going to be heard. Now, we're going to essentially reduce the cuff pressure in a gradual fashion. So we see your pressure drop below 120 millimeters of mercury. And then we're going to listen or auscultate with a stethoscope for sounds within the brachial artery. So we're looking to see if sounds are audible within the stethoscope. Now, the pressure when the first sounds are heard, once we start this gradual release, is going to be essentially when there's a small amount of blood that is coming out of that constricted artery. That's the systolic pressure reading. As the cuff gets reduced even more, there will be additional sounds that become louder and more distinct. And then over time, when the artery is no longer constricted and the blood can flow freely, the sounds will no longer be heard. And then the pressure at which the sounds go away, when the sounds stop, that will be the diastolic pressure. So in this example, we see when those sounds are first audible is at 120. So systolic is 120, diastolic is 70. The value at which those sounds stop. Here we take a look at capillary function, and capillaries form networks called capillary beds, and the flow of blood from the arteriole to the venule is referred to as microcirculation. Now, when it comes to the amount of blood that is found within our bodies, there's not enough of it to surface everywhere in our body at the same time. So at rest, there's only a small fraction of the capillary beds that are fully open, meaning they're allowing for movement and flow of blood to occur all throughout the capillary network. And that's important to consider because when we have our capillaries, that provides an opportunity for exchange of gases, nutrients, waste within the surrounding area. Now, in order to regulate different areas of the body, so deciding where we'll be able to divert some of that blood flow to different capillary beds, we have these capillary sphincters. And so these sphincters we see are on the arterial side rather than the venule side. And these will act as valves that regulate blood flow into the capillary. And they can be controlled by chemical conditions within localized areas. So we can regulate, when we think about that fight or flight response, blood flow towards regions of skeletal muscle and away from the digestive system in order to help with the process of running away, right? So that flight response. Now, in looking at these two examples, we can see in the relaxed state that there is movement of blood all throughout. So it heads through the main thoroughfare channel, and the main thoroughfare channel is what is directly connecting the arteriole and the venule, and it's also traveling through the quote-unquote true capillaries. So we see blood flow everywhere. So in that state, when we're able to accomplish that, the precapillary sphincters would be open. Now, if the precapillary sphincters are contracted, then we'll still have blood flow, but we're only going to have blood flow straight from the arteriole through the thoroughfare channel into the venule without passing through the true capillaries. The cardiovascular system is a closed system, and because the vessels are connected with one another, nothing is open-ended. But based on how our vessels are organized, water and solutes within our blood can exit out through the walls of the capillaries, and then that will exit out into the interstitial fluid, or the ISF, which is abbreviated up here. Now, most of the fluid leaves the capillaries at the arteriolar end, so the arterial end here, rather than the venous end, and that really has to do with the amount of pressure that's seen on this side comparable to this side. So more pressure built up here means that more fluid will be lost, and so the height of these arrows is meant to indicate the amount of pressure and therefore the amount of fluid that is moving out of the capillary. When it comes to fluid loss, we don't want to lose this because we need to utilize these fluids to help maintain pressure and essential blood flow. So we want to return that fluid, and that fluid can be returned through osmosis. So there's a certain level of osmotic pressure that's applied to the capillaries. And the reason why that can be accomplished is because within the vessels, there exists plasma proteins. And so proteins are found within our blood, and the size of them makes it impermissible for it to make its way out of the capillary. So they can't really escape through the pores that are found within this particular type of blood vessel. So what that means is that there's going to be an increase in the concentration of these proteins in the blood plasma that is going to be significantly higher than what is seen within the interstitial fluid. And so that difference with respect to protein concentration causes water to want to enter the capillaries, right? So that's the idea of osmosis and the idea of trying to kind of generate this equal distribution of concentration on either side. And so rather than move the solute, which in the scenario is the protein, what we're doing is utilizing water to try and create an equal distribution on either end, right? So in essence, the body's trying to dilute the proteins that are within the capillaries in order to reach equilibrium to a certain extent. So the difference causes water to move in. So that's the blue arrow, osmotic pressure. And it's going to move from the interstitial space into the vessel. Now, when you compare the arrows here, notice that the arrows are consistent with respect to their length. And that is because regardless of which end of the capillary we're at, the plasma protein concentration is consistent, so the osmotic pressure is consistent. So where we'll see a difference is the net fluid movement out. And so the difference within the net fluid movement out is based on the fact that blood pressure is declining as we move from one end to the other. So osmotic pressure is present under normal conditions when those plasma proteins are there. Now, when it comes to abnormal situations, it's entirely possible that the capillary blood pressure can be too much. And so there can be too much fluid that enters into the interstitial fluid and will end up accumulating. And this can cause edema, which is the swelling of tissues. And this can be commonly seen during pregnancy, and that's due to the increase in blood volume and the compression of veins due to changes in uterus size, and that results in increased blood pressure in the lower limbs of the woman as well. And there can be, temporary edema, or depending on the severity or issues that occur within certain systems within our bodies, it can be something that is long lasting and needs to be kind of clinically addressed. So in pregnancy, it's something where, it presents itself for a short period of time and then it eventually goes away. Now, in general, there's always going to be more fluid filtering out that needs to be returned. So when we take a look at that net fluid movement, notice that when you're looking at those arrows, and we can go back to it briefly, notice that those arrows are always a little bit longer, even when we're at the far end of the capillary. they're a little bit more than that of the osmotic pressure. So movement is going to kind of favor fluid loss. Now, when it comes to this fluid loss, we do have a mechanism for return, and that is going to occur through the lymphatic system. And the lymphatic system is shown here in green. The lymphatic system is composed of a bunch of vessels. So there are capillaries, other lymphatic vessels, there are lymph nodes, there are lymph organs, and discussions related to lymph nodes and certain lymphatic organs are relevant to the immunology discussion. Now, when it comes to the lymphatic system and the vessels, they're really permeable. And that's important because that's going to allow fluid that's found within the tissues to drain into them, right? So we're trying to pick up that residual fluid loss that occurs because blood pressure is going to exceed the osmotic pressure. Okay, and so as a result of that, there will always be some fluid loss as it moves through the capillaries. Okay, so the lymphatic system's job, in addition to others, is to help return that lost fluid to circulation. When it comes to the movement of that fluid, once it enters a lymphatic vessel, it's referred to as lymph. And lymph will move through vessels through one-way valves until the lymph essentially enters two major vessels, which will drain into subclavian veins. And subclavian veins are found under our collarbone, so subclavicle. The lymphatic system, in contrast to our cardiovascular system, lacks a muscular pump. So movement on lymph depends on skeletal muscle. And so squeezing against the vessels will help to drive that lymph to where it needs to go. Concept 42.4, blood components function in exchange, transport, and defense. So within this module, we're really starting to think about the role that blood plays a little bit beyond the obvious, because more often than not, when we say the word blood, we're really just thinking about erythrocytes, when in actuality, blood is a type of specialized connective tissue that's comprised of a ton of different things. And we'll place our emphasis on closed circulatory systems, but as a reminder of what we discussed in earlier modules, when it comes to open circulation, the fluid is continuous with the fluid that's surrounding all of the body cells. So for example, we would use the term hemolymph when thinking about open circulation because of that continuous nature. Whereas for the closed circulatory system, they're confined to vessels, and that will be the time in which we use the term blood.